Starting recording. It's still setting up the streaming.
I don't want to advertise Bucky's little run.
It says it's live. It says we're live.
Time flew. My goodness, so fast.
It sure did.
My goodness.
I'm just starting the Facebook event. Let's see here. We should be live on Facebook now. Let's see. It sure did. Yeah. I'm just starting the so it's live on mine. Facebook now. Let's see. It sure did. Yeah. I don't know why it's doing this. Sorry. I'm clicking buttons. Okay. We'll
You're
go
in
ahead and get
control.
started. Let's see here. Do we have anybody else joining us right now?
We can so we're gonna start with introduction of ourselves, right?
All right. Yep. So thank you for joining us on today's episode of the Cancer Conversations and Choices. We're going to read a disclaimer first, and then we'll get started. We're going to talk about diabetes today, which we're all pretty excited to discuss with you guys. There's some pretty good information that we're going to go over, and yeah, we'll just get started. So for this is just general information purposes only. It does not constitute the practice of medicine, nursing, or other professional healthcare services, including or giving in medical advice, and no doctor-patient professional relationship is formed. The use of information on this show or materials linked from the show is at the user's own risk. The content of the podcast is not intended for to be a suitable it's not intended to be a substitute for professional medical advice, diagnosis, or treatment. Users should not disregard or delay obtaining any medical advice for any medical condition that they may have and should seek the assistance of their healthcare professionals for any such conditions. If you take any action or inaction as a result of any of the content you consume on Cancer Conversations and Choices, this is based solely on your decision, and the Cancer Conversations and Choices podcast and their host cannot be held liable for any consequences of such actions or inactions. Please consult a doctor or other healthcare professional if you have any concerns regarding your health. Always seek advice or be your physician or other healthcare professionals or provider any questions you might have regarding a medical condition. If you do think you have a medical emergency, call your physician or go to the ER or call 911 immediately.
Cool.
So we're all good with the legalities of everything. Why don't we go ahead and get started?
Okay. I'm just gonna start. I'm Simand. I'm a holistic cancer coach and functional nutrition and lifestyle practitioner. And I'm also diabetic, so that's why this topic is so hot for me and so interesting to talk about, because what I've been through, trying to learn everything about diabetes for past, I would say 18 years since I was diagnosed. And so I personally trust that our body can heal itself, and instead of balancing diabetes, I truly, believe that we can reverse diabetes.
Mm-hmm.
My name is Debra Hernke, and I'm a holistic cancer coach. And I'm also a functional nutrition lifestyle practitioner, FNLP, as well. And welcome.
And I'm Marinette Smith. I'm also a holistic cancer coach, and then I am also a registered nurse. I'm not practicing as a nurse in this function at all. I'm just as a coach and providing you information. But yeah, we're excited to get started with all of this diabetes talk today. Maya's and Deb's got some really good stuff that they found. We had some good conversation before we got started, so we can't wait to share with you guys what we've been talking about.
Yeah. So for me, diabetes is such a kind of I would say, hot topic for me, because I'm a diabetic. My sister's diabetic. My parents were diabetics, and my brother is also diabetic. So um, when we talk about diabetes being in your genes, so I always question myself, is it really in our genes, or it's something that our body created due to our lifestyle and our, diet. So I strongly believe we might have some genetic probably predisposition to that, but that doesn't mean that we were meant to have diabetes if we had a proper lifestyle, and
Mhm.
that's what I strongly believe in, that because the way we are as people, especially last 50 years, we've been exposed to excessive amount of carbohydrates intake. I mean, it's been for a while, but past 50 years, I think it's very strong and aggressive. Intake of carbohydrate has been changing people's lives and then people's life, and then creating a lot of metabolic distress and causing the problems.
Which,
So
unfortunate, this is like our basis of American diet is the carbohydrates, is very, very heavily saturated, even in sugars.
right. So I do question myself when it comes to that. So what I'm going to be talking today is going to be basically related to me trying to understand my own body, me trying to understand what diabetes is and how our body create diabetes. So, and just going from my personal life experience, I don't think like a diabetes is a genetic disease. It might be diabetes type 1 might have, like, it is a genetic disorder, but again, there's a few things that I've been like a learning lately past year, that the certain lifestyle can even improve type 1 diabetes. And there's a few things that a few studies I've read that can reverse even type 1 diabetes. So this is to me something new, and I'm like, it's mind-boggling to me to dive in and learn. I personally do not use any medications. I control my blood glucose levels with the diet. So, and that's why I could say that lifestyle and diet plays a big role in, in balancing your blood glucose levels. So,
It's going to be exciting to hear what you've experienced, what you've seen, what you've experienced with helping other people. And Deb and I can even share in our own personal experiences too. But yeah, we can't wait to hear more. It's exciting.
yeah,
It's exciting, some of the stuff that you've told us.
yeah. So one of the main things that I understood, like, if you have diabetes, do you really have to add, like, the one of the biggest reasons of diabetes is diet and lifestyle, right? The stress, diet, and lifestyle. So the diet is probably now number one. It's not everything, but it's a foundation. So when we when we talk about diabetes, uh, the way that our body works, and when we talk about insulin resistance, so what could create insulin resistance? So my understanding is, like, the way I have done reading and research, like our body is basically fight mechanism, like flight and fight mechanism of our body creating insulin resistance. Let's say it like, let's say you have a cell. So the way I talk to my clients and the way I explain to them, it's like, imagine you're a little child. Let's say glucose is a little child, right? And then we have to take that little child and bring it to the cell, which is a daycare. Okay. So the mom is a transporter. So she takes the child and she takes it to the daycare. So, and then the cell has the doors open, which is the insulin receptors, and let the child go in. So daycare has its own limit, can only accept 10 kids and cannot accept more than that. Okay. But when the doors, when there's no rules, when people have no rules and keep like eating high level of carbohydrates, and the blood glucose levels increases. So a lot of kids start going through the door, entering the kindergarten. So at some point, kindergarten is going to have 100 kids instead of 10 kids. Okay. And it would be, forced to shut their doors off So no more kids can go in. Same thing with our cells. Like we cannot let, like our body can take certain amount of glucose into the cell to create energy.
Right.
But then when we keep adding that, and glucose start increasing, so the cell protect itself, not to go into the dysfunction or the stage when it cannot function, it protect itself. And it would create this insulin resistance. It wouldn't allow insulin to enter to bring the glucose into the cell. So, it has a limit. So, and that is like protective mechanism of our body of, and then, but we are keep consuming carbohydrates. So we're getting this high levels of glucose, and it has no place to, the cells are not accepting anymore. So, and the body keep releasing insulin because it has to transport the, glucose into the cell, and the cells are not accepting. Where do they end up? That glucose ends up in your bloodstream. And that's when the blood would show high level glucose. It doesn't happen overnight. This happens through time. So, and then you'll keep eating carbohydrates, and you are keep getting that glucose in your bloodstream higher and higher and higher. And it goes to the point when the body starts developing, diabetes type 1 and a permanent insulin resistant, because no one sit down and will talk to you that consuming carbohydrate, this is what insulin resistance is. But we were told that we can never reverse insulin resistance.
Yeah, that you would be on medications for the rest of your life, even if you do change the
exactly, because we are because we need carbohydrates. We were told we need carbohydrates. The question is, do we really need carbohydrates when we're having such a huge problem internally, to bring the carbohydrates back into the picture? It's like adding, it's like, as I said, like you have a fire that you wanna, turn off, but you keep adding the oil. Same thing with diabetes. You wanna get rid of diabetes, but you keep adding the carbohydrates into the picture. And then you cannot reverse your diabetes. You cannot reverse your insulin resistance because you keep adding, It's impossible for your body to get rid of what it created because of the overload of the glucose, to get rid of it if you keep adding it. It's impossible. So you have to stop adding to be able to reverse the process. So that is a very simple way of like explaining what is diabetes, and I hope that made sense.
Oh, it totally made sense.
It's like, yeah.
It's so confusing. Diabetes is so confusing.
Right? Yeah, it's confusing because they made us believe in that, that we need this, and this is the lifestyle we got to follow. And if you go to American Society of Diabetes, you could see like recommendations they have, the carbohydrates in the morning, having like a oatmeal, or you need fiber, you need carbohydrates, you need that, you need this, but you need to eat like a small meals every 2 hours. It's like everything opposite what you have to do to reverse your diabetes. Everything is like what's in there is like opposite what you have to do. Every meal you consume is going to spike your blood glucose levels, and it's going to release more insulin. And it's going to come to the point when your body is not, it's going to stop releasing insulin because your pancreas is going to get overwork itself. And then people develop problems with pancreas, So, and yet along, like talking about diabetes, the glucose causes so much damage in the cell. And then when there's constant present glucose inside the cell, insulin inside, or the glucose inside the cell and the insulin in the body, so every organ gets damaged by it.
So that's where there's inflammation, right? With
that
diabetes.
Brings up the inflammation, and it converts it into the chronic inflammation. And speaking of the cancer and diabetes, it does not directly feed the cancer, but it would create a perfect environment for cancer to grow. So if we are going to continue giving like even in the small amount, you know, we're kind of supporting the cancer growth in
Oh,
in the body.
yeah.
Even consuming carbohydrate, that's what I mean. Even consuming small amount of carbohydrate, we are adding, you know, a fuel to a cancer.
So because you haven't gotten rid of the fire, you're just like you're saying, you're just adding oil to the fire.
You
And then
just
when you
keep
add cancer to it, it's adding even
exactly.
bigger fire. It's like a bonfire.
Exactly. It's like a bonfire that never turns off. So uh the one of the main things that I understood for myself, like I cannot keep adding the thing that caused the problem in the first place. You know, this is one of the things that we never talk about, like the entire system. We talk about balancing glucose levels. I always ask myself a question: what does it mean, balancing blood glucose levels? What exactly it is? I really want to know. Like, what exactly are we doing? And why are we balancing? Why aren't we talking about reversing? You know, because I do hear a lot of people talking about, oh, this is a perfect diet for diabetes. This is diabetic friendly meal. This is diabetic friendly, like whatever, cookie, whatever, you know. Is it though? Is it?
Did you
This is
just say a
like,
diabetic friendly cookie?
yes, there's a like a when you go out and you see, like I had someone came up to me saying like, look, I want to create a candy that would be friendly for would be okay for diabetic people to use. And I was like, okay. As I was scratching myself, is something like that ever existed? I don't think personally, I don't think so. You cannot create like, you know, you can add artificial sweeteners, but then again, how are they affecting our body? You know, how are we doing? I mean, like everything we have to question. And so that's from my like the very little thing that I've been learning about diabetes, and this is from my life experience. Like reversing diabetes requires not consuming carbohydrates. And don't think like going on very low or no carb diet that people think, oh, you know what, I'm going to get rid of diabetes right away. Some people get lucky, they do, you know, they reverse their diabetes. But some people, for me, it took a long time. It took a good like a year or so to see, you know, blood glucose levels coming down, because learning how to adjust protein intake, that's another way, because our body can make glucose out of amino acids, out of protein. So for me, it took a while learning what's my protein intake has to be in a ratio to fat. And and you know, so it took me a while to bring my blood glucose levels down. So there's a lot of, you know, people, a lot of dietitians, everyone is talking about balancing diabetes. But from my personal experience, the way I experience and the way I feel, when you cut the source, that would be the only way when you can reverse your diabetes. And if you think you want to balance it, then you can balance it that way. But I still don't understand that balancing diabetes,
You
like
have a really good point.
what it is. You know what I'm saying?
Yeah, like cut the source. I mean, if it's almost like they're trying to appease you're wanting to eat unhealthy
Right.
items or food items.
Right.
So they tell you to balance it out when in reality it sounds like you just need to get rid of it and start over.
Yeah. Right.
Hmm.
That is so true. And then we start of course, the system invents drugs for people, right? To lose weight, to control their diabetes. I was doing I was writing paper on diabetes. And then I asked ChatGPT, I was about a year ago, I said like, what had doctor used before the insulin was invented on people who were diabetics? I just asked that question, ChatGPT. I think insulin was invented in 1921 or 1929, if I'm not mistaken. So the ChatGPT replied that the doctors at the time had four options. Option one was lowering your caloric intake in terms of like lowering like your food to like very minimal, and eating like a few times a day, but small amount of food, that process did not go well because people became, malnutrition from eating very small amount of food and wrong food. Second thing was eating 1 or 2 meals a day, small meals, and no carbohydrate meals. No, eating 1 or 2 meals, fewer meals a day instead of many meals a day. Number 3 was putting them on ketogenic diet. And number 4 was putting them on carnivore diet. So this is the 4 things that doctor was implementing before insulin was invented. And then ChatGPT states like after insulin was invented, people start, how was it saying? It was saying like that it was a big breakthrough for people with diabetes because people could enjoy their life and use the insulin. So, and I was like, do people really enjoy their life by using insulin and continue consuming carbohydrates, but still having side effects from diabetes, like neuropathy? Some people's feet get, amputated because of the necrosis. People get dementia, people get like different diseases, like many
heart attacks
diseases,
and heart issues,
heart
right?
attacks, heart issues, like, so many complications from diabetes. The question is, do really people enjoy their life being on insulin? And that's what like a kind of throws me off. Like, why aren't we speaking about stuff like that? Why are we still listening to a system that is just makes people sick? I would say, if you are not seeing a result for a year, why are you doing the same thing over and over? If you're not seeing the results,
So why aren't people speaking out about it? Why aren't we asking the questions? Why am I still on this, and how can I get off it? To your doctor.
Why am I why am I not getting better? Is the insulin really a chronic condition? Is it autoimmune disease, or did we create this autoimmune disease? Do you know what I'm saying? Is it truly our body's fault? Which I doubt it. It's not our body's fault, because our body is such an intelligent mechanism. Like I'm working with a client who's 77 years old and many years on insulin, I believe so, around 30 years on insulin. Okay. So by changing his diet and lifestyle, at the age of 77, he's off of insulin over a month now. So the whole point is, even being tortured with so many drugs past 30, 40 years, his body still can reverse itself. His body's still fighting to survive, and balancing everything. And the whole process was just changing the diet and lifestyle. It wasn't anything major. And it is, for some people, it's hard, but once you understand the entire process, you have a better knowledge, and you don't want to go to that stage of going to a place where you don't feel comfortable, but gaining more energy and you feel comfortable. It's like you're waking up every morning, have tons of energy, you're feeling great, there's no joint pain, there's no muscle pain, there's like your physical activity is high. I mean, it's such a different, even, the vision.
It's an amazing trade-off.
Yeah, it's a vision that got damaged from diabetes over years get reversed. So there's so many things our body is fighting for, and we are our body is very intelligent, but what is not intelligent is our mind. We don't listen. It's not like we don't listen. We listen. What is not intelligent is ourselves. Like, we are listening to someone's words, and then we go ahead and do what someone else says without questioning, was that person even right, what he said or what she said? Is that the really like my body needs or has to go through? You got to do your own homework. You got to do your own research and learning and understanding that. the body. That's when I start realizing for me, yeah, I have done everything. Like when it came to diabetes, dietary changes, I went vegan, vegetarian, you know, lots of juicing. I was taking all form of like, supplements, berberine, like you name it, gymnema, uh,
Mhm.
whatever, the cinnamon. I mean, you name it. I tried everything in a high doses, lower doses, and so many dietary changes. But one thing I understood, until you still bringing the source, like that causes the problem, you're not at those berberine won't make a big difference. Those like a gymnemas or the bitter melon or whatever the supplements are not going to do anything for the body unless you change the source itself, unless you eliminate the source that create the problem on the first place. That's it. That's what I could say about diabetes for someone who's been diagnosed for 18 years and have tried so many things. So not until I saw the result when I just cut down the source itself.
Mhm.
So
Yeah, I think one of the things that when we talk about a diabetes and asking, having asked the questions, bring it up to your doctor and ask them questions about stuff. But sometimes I think even then going into a doctor's office, you get kind of overwhelmed and you get scared. I mean, you kind of don't want to, because am I challenging the doctor? Are they going to say, you know what, get out, don't ever come back, don't ever question me again? And, and I think sometimes that, kind of can creep into our minds a little bit with the doctors. But like, for example, I think that it's understanding what exactly, and you explained it really well, diabetes, what it is, and basically the body being unable to, properly process and regulate blood sugar, and blood sugar being glucose, that, and this can happen either because the body doesn't produce enough insulin, and we talked about insulin and insulin resistance, and maybe not really understanding what insulin and insulin resistance is. So not having that maybe information, or just not knowing how to research that and whatnot. So basically, so in your body, it doesn't produce, if it's not producing enough insulin, which is a hormone that helps the cells in the body absorb glucose. That's what insulin is. That's what it does in our bodies, or because the cells become resistant to insulin. So you've got insulin and insulin resistance. So, and those are, when that happens, then you basically you're going to come up with two types of diabetes, type 1 and type 2. And those are some things also then when you get that diagnosis, well, what exactly is that? And to being able to do the research on that. But actually there's a third too, and that's gestational diabetes, and that's a whole other animal. And for women, obviously gestational diabetes is when you become pregnant and your blood sugar levels like, wow, I wasn't diabetic before, but now I have gestational diabetes. But when you don't have that, and then you give birth to that child, oh, amazing, you don't have diabetes anymore. However, you are more susceptible later on in your adulthood life, so that's a whole other animal to talk about. But anyway, I just wanted to bring that up too, is the insulin and the insulin resistance, and actually what insulin is and what we're talking about when we do talk about that. But again, do your due diligence and do your research with that.
Your research, yeah. The other part that I want to touch is like diabetes and autophagy, and then diabetes and vitamin C absorption. People are with who have diabetes, they will have a hard time going through the process of autophagy, and that's an important process when the body destroys the weak cells or cancerous cells, help to regenerate, replace with the healthier cells. But when we're people who have diabetes, the process of autophagy is basically comes to, zero, because glucose is slow. So that inhibits the autophagy process, the autophagy, which is an innate ability of our body destroying like a weak cells on its own, because of the, it would destroy the weak cells to get rid of them and replace them with the new cells, because that's like what our body does. But when we have high levels of glucose, that process doesn't happen. And people either do prolonged fastings, and then after prolonged fasting, they start going back into consuming carbohydrates, and then hoping that they did a good, maybe temporarily, they had this process of autophagy, but then going back and it slows down. But when you stop consuming carbohydrate, that process of autophagy is on continuous, basis, the way your body meant to have, the way your body meant to do, all the time. Because it's a cycle that goes in round, like the weak cells would get destroyed and get replaced with new cells, old cells, the weak cells, like would get replaced by the new cells. That's a process of our body. That's one of the things. The other thing is vitamin C absorption into the cell. The glucose competes with vitamin C because they have basically the same transporter that would transport either glucose or vitamin C into the cell. So they compete with each other. So cell would take more glucose than vitamin C. And it's inhibits, so diabetes inhibits absorption of vitamin C into the cell. It does. And then when people go through oxidative stress, and they need that vitamin C because vitamin C is antioxidant, right? It breaks down or binds those free radicals to other things to balance everything in the body. And then here we don't have vitamin C, enough vitamin C to do so.
Which then leads you to infection and illness, right? Disease.
Right. And then plus like other antioxidants affects the same way. So that we have to think is like we can, keep taking vitamin C supplements or vitamin C with food or something, but that doesn't mean your body would absorb it if you have diabetes.
So you could just be wasting your money. Like basically I know people that take significant amounts of vitamin C to be able to help like boost their immune systems.
Right.
But here, if they're still having a high sugar diet, high carb diet, or they're insulin resistant or have diabetes, it's not going to really make that much of a difference. So you're kind of just throwing it away, right?
Yes. So that's like I'm talking slow because in my mind I gotta like kind of make a right sentence here. Because I don't want to like talk from here and there and there. I just want to like say the other part is like glucose molecules binding themselves to fat molecules and the protein molecules. What happens in the body when they bind themselves into fat and protein molecule? So combination of food also matters. So we listen to people. Your plate has to have this much of carbohydrate, this much of a fiber, this much of a protein, and whatever, right? We don't even understand what's a biochemical process of those things in our body. We just hear somewhere because someone is recommending that, and hear people go, this is what your plate has to look like. Is it? Is it the way your plate has to look like? Do you like, for me, because I've tried so many different things and I would always like hit the wall. It would not work. Every time when I would read something or someone's book or something like that, you need like a apple cider vinegar. It slows down. You got to eat your fiber first and then eat this first. That's going to lower your blood glucose level. I have tried all of those things, but every time when I would try, I would hit the wall. It would not work. And the question was, why am I hitting the wall? Why my blood sugar is not going down? I've been doing everything what this book says. I've been doing everything what this like talks about, but it's not happening. Why it's not happening? Until I just sat down and I just broke it down for myself, entire process, like of the glucose, like absorption and the way the body breaks down the glucose. And it made so much sense for me why it didn't work before. So, and that's where and that's what people are facing. They're trying, they're doing different things. They're hearing there and here everywhere, and they're doing the stuff and they're hitting the wall.
Okay, so if I'm following you right, then so basically our vitamin C and our glucose are competing on the same pathway to get into our cells.
Yes, they
If
are.
we have high blood sugar,
Right.
that's
Yeah.
going to trump the vitamin C. The blood sugar is stronger basically,
Yeah.
and will block out the vitamin C from getting into our cells.
Yeah.
So if we think,
Sugar.
for example,
Right.
if I'm taking, or even if I go have an IV infusion
Right.
somewhere, and
Yeah.
I'm diabetic, and
Yeah.
my sugar levels are so high, that vitamin C is useless. It's really not getting in there, and it's just going to be flushed out of the system because it's
Yeah.
actually not getting into the cells at all because of being trumped by the high blood sugar, by the
Um,
glucose.
I would say that yes. I mean, like, I mean, body might absorb
Hmm.
but not, even though IV, it's going to be the way I think it's going to be a waste of money because your diabetes is still, if you have a high blood sugar levels. So IV is going to take it to your bloodstream. Might do some work because it goes straight to the bloodstream, right? From there,
Hmm.
the
Hmm.
excess vitamin C, the bloodstream, yes, but would it enter the cell though? That's a big question. Is it going to enter the cell?
It doesn't seem like
So,
it does. It seems like, yeah,
right,
the glucose is going
right,
to trump the vitamin C and getting into the cells.
right. So, and then
Mhm.
the excess of vitamin C, it's converted into the oxalic acid, in our body. So if it's going to be more, if it did not enter the cell, floating in the bloodstream, so it would convert it into something, because body always tries to get rid of the stuff. So
Hmm.
the way I know that it mostly converts it into the oxalic acid. And the oxalic acid is, what is it like? It could, generate stones. The more you take it, it's going to generate stones, like, kidney stones, or, you know, they're more into that oxalates, also thinking that way. Um, Oxalate going to bind themselves to calcium,
So we need to
and deliver
then,
the calcium
yeah,
from the bones. There's so many ways of looking at the stuff, right? So we are, yeah, we always have to go, we have to understand mechanism of our body to be able to help our own body. It's not about drugs or pills or supplements. We do take those supplements without even questioning, are we doing the right thing? Because someone told us it's good for
right.
you, right?
I
Yes.
heard it somewhere.
Yes.
We keep hearing that someone told us, some companies said it's good for you, it's going to help with that and that and that. So, and then we are just keep taking it. But
Right.
I have so many people coming to me with taking 20, 25 different supplements, but their condition did not improve. And they go to different doctors, I mean, like, or naturopathic doctor or other doctors or coaches, they still tell them, oh, bring this. They keep adding.
Yeah.
So this is
Hmm.
reminds me of medical system. So you go to the doctor, they give you not supplement, they give you drugs. So, and then they keep adding the drugs without looking what the underneath, what is it like, the cause of the problem on the first place. So we switched basically from using supplement, I mean, like, drugs, to using supplements and doing the same pattern. We're doing the same pattern again. And we're thinking, oh, we're doing something good for our body. Again, the question is, are we?
Right. So that's why,
So
I mean, it seems like, so just, and that's just, I mean, that's just, and I'm just bringing up vitamin C. That's just one piece of it. But for me, if sugar is that powerful in our body, it can block vitamin C. There are other things that obviously it's blocking too, that is not allowing the good stuff
right,
to get into our cells to make us stronger, our immunity's built up and stronger to be able to fight disease. And if that's not there, then I mean, obviously, it just seems to me then your diet and lifestyle, changing that to be able to, like, you'd said, with the carbohydrates and everything, your diet. So not, to be able to actually find that balance and everything is to change
right,
our diet. So it's knocking
right,
out the sugars, because the sugars,
right,
and we've all heard that before too. I think, how bad sugars are for us and everything, but sugars are in a whole lot of things. And they're in our carbohydrates for one, as
right,
an example for that. So if we cut that out of our diet, that's going to be huge. And then that's changing our lifestyle. So it
right,
kind of goes hand in hand with that. And then the exercise and all of that. So it goes in there, but that's huge. You're right. And
right.
it's understanding that and actually, yeah.
It's a
Right.
mindset
Yeah.
change. Like you having
It
to
is a
like
mindset change,
completely
right?
think about
Yeah.
things differently. Like, I mean, you're talking about going
Yeah.
back to things where it's simple,
Yeah,
like
absolutely.
simplicity.
Right.
We don't need to keep adding this, other supplement or this other vitamin or sometimes even like different modalities. Just going back to simply like, what are you putting in your body? What are you consuming?
Right.
And what are you willing to, would you give up that sugary pastry for, your life or to save a limb, to save a finger later on in life, to not go through cancer, to not go through a lot of those things? Like, what are we willing to give up? And I think once we really focus on that and we decide to say, yeah, no, I want a better life for myself, it's a lot. We're still fighting like the culture. We're still fighting like the media. We're still fighting peer pressure about, I don't know, going into an office and having everybody bring like a bunch of cookies or donuts. It's really hard to continue to always say no when it's right in front of you, you
Right.
know?
Yes. Yeah.
Hmm.
And then when I was diagnosed with breast cancer and then I had chemotherapy, when you walk into the, room, they serve candies, they serve cookies for people who have cancer, for people like, in the hospitals, the worst food you can get in a hospital environment, the worst food. It's a place people go to get better, and everything worse you can get from that place, right? So we at that time I had no idea about glucose affecting the, you know, uh, cancer. This was in 2009. At that time, I had no idea. Like I had to cut down on glucose and carbohydrate intake to, to help me, heal from cancer, to get better. So it was all about, chemotherapy, radiation, and mastectomy and other things. So like hormone replacement therapies. But then when cancer comes back, I ask myself question, why did it come back? Again, no one could tell me like I have to change my lifestyle. There's a lot involved in there. There's a lot of like seeds has been like planted in my body that keep growing right now and popping up as a different, in different like things like cancer, diabetes, like thyroid condition, hormonal imbalances, like all this little seed that no one talks about, that your body doesn't need them, that uh and then the steps that I went through, it's all like educate myself. I got to educate myself to be able to take care of my own body. It's not listening to someone, because the science is there, but not every science is accurate what you read. Let's say you have to see who's like funding the science, where the research is coming from. If the research is coming from and funded by food and drug companies that they don't care about your health, they don't care about, if you have diabetes or not, all they care how much product they're going to sell to you, how much carbohydrates or packaged stuff they're going to sell to you. So it's all about you doing your, homework and learning about it. So that's my
Mhm.
entire, like, all this years of decades of doing research, just because I want to help myself and my family, right? You're muted. Annette, you're muted. Yeah.
Oh, I was just going to say, like, it's interesting that you were bringing that up because you had cancer a second time and then asking, like, what is really contributing to this? And you having to figure that out yourself when you're going to see these people who are medical professionals, right? Like, you're
Yes.
paying them for their services, but they couldn't even tell you that and you had to go figure it out on your own. I think it's a big disservice that we're doing
Yeah.
towards people, for people, if we're not able to give them, it's a simple answer. It comes
Right.
to what it sounds like you found is a very simple answer to your
Yes.
issues that you were having that were affecting your quality of life and ultimately threatening your life.
Yeah. So yeah, another thing, one more thing that I want to talk about, that it's very big right now, all this like GLP-1, antagonists, like drugs they bringing in and offering people to take it for, lower the diabetes, lower their body weight. Again, they're introducing something without letting people know the fuel is still, they're still consuming the fuel, they're still consuming the fuel, and then bringing this medication into the picture. Yes, it might lower down certain things. It might slow down your, your hunger levels because it's affect your hormones, right? But have you ever thought on the long term, where is it going to take you? Where your body's going to be at? Because that's something that GLP-1 that get produced in your digestive system, that controls the hunger, controls hormones and many things in your body, and you're pressing down that. Do you ever ask yourself a question? After pressing for a year or 2 or 3 or months or 3 months, where is it going to take you? What's the outcome is going to be? So we have to be very kind of smart. I think we're going to be smarter than the system is right now. Instead of listening, just doing your research and learning and doing it the right way. Because diabetes is just, I would say, a number one toxicity to our body. Not diabetes, yes, but the glucose, sugar. It's a drug number one as of now, I would say, that destroys so many cells, interfere with the activity of the brain, of the mind.
Well, it's so addicting.
It's
It is
so
a drug.
addicting.
It should be
It's
considered
so
a drug.
Yes, yes.
It
And
really
for
should.
people, and for
Yeah.
people who tells you need the carbohydrate to generate energy, ask them to show you the science. Ask them to show there's a science, there's a research, but they ask them to break it down for you. Why do you need that? Why do you really need those carbohydrates? Do you really need it? So, and what percentage? Because we're all the species in this world that surprises me that are so confused about what we eat. We're so confused that we don't know what to eat, how much to eat, in what ratio to eat, how many eggs to consume a day. And we've been told you can eat only 1 egg a week or 2 eggs a week. You can eat this and that. And the question is where this information is coming from. Where are we getting this from? That I can eat only this much, or this should be my protein intake, or this should be my caloric intake. What does it mean, caloric intake? Do you even know what calories are? You keep talking about caloric intake, but you don't even know the calories. You cannot even measure calories. How people do even measure calories? How do they convert them? I don't know. But the calories is like a basic energy. Can you measure energy, or are you taking calories intake based on the energy that food is going to give you? Okay, so
it's more complex than what they just led on to. So if we just hear oh, eat some, you still need a few carbs or whatever, what does that actually really even mean? It's there's just so much generalization on all of it. But then even if you go back and you look at how they found the food pyramid or the dietary needs that we need, that's not all legit or great either. It's not very solid science. And what they did was really not ethical either. But I mean, if you go back and you see, it's like you're saying, so who says what we need at this point in time, why we need it? So it's funny, it's interesting when you do go into how you switch everything and reverse it all, even for that guy. You find out, you kind of can see in your own mind with your own critical thinking, oh, well, that makes sense why they didn't want everybody to know that, or this makes sense of why they aren't going to give all that information. That information is not going to be, public knowledge. So it just leading into, probably the next conversation that we'll have next week, but it's just interesting because it's very simple. Take things away, not keep adding to it. But you're right, it's going to be the bottom line for certain people that it's going to affect.
Right. Yeah, eating, like people tell you eating rainbow. Where is that coming from? Where is it coming from? We need fiber. Where is it coming from? Is there legit science behind it? No, I couldn't find any.
Well, and you notice too, the way the wording is, sometimes the wording is skewed or it's very oh, what's the word I'm looking for where it's misleading?
Misleading, yeah.
Misleading?
Yeah,
Yeah.
misleading, yeah. So, or we need 20% of
Oh.
carbohydrates a day, or we need 30% of carbohydrate, or we need 50% of carbohydrate. Where is it coming from? Because there's so many things that affect those factors. They're your lifestyle, the way your stress works. Do you work out? What kind of work do you do? What do you eat? What environment you live in? Because there's so many aspects that comes into one picture when they tell us you need 20% carbohydrate, you need 30% carbohydrate. I mean, like, where is that information coming from? I really want to get to the bottom of it and understand. And the reason I wanted to talk about stuff like this is because I see from my clients constantly coming to me, and or even would send me a text messages taking a picture of the food or something at the store and say, "Is this okay for me to eat?" I don't know.
Mm-hmm.
Do you know what I'm saying? I don't know if it's okay for you to eat. Maybe it's okay, maybe it's not. Do you know what I'm saying? It's like your body is your body. You have to learn about your own body. It's not me telling you what it is. So why are we listening to everyone around us and like doing the stuff that we are not even questioning? Just because someone is doing so. I've done it for myself so many years. I've done that. I did this. I jumped from this to that. I jumped from this form of eating, this lifestyle, that lifestyle. And right. And then it just, you hit the wall all the time. You hit the wall and then, okay, why isn't it working? Are these people online? No, it might work for them, but it's not working for me. Right. So, and then we got to ask those questions. And then diabetes and cancer is huge. It's huge. I wouldn't like, when people get diagnosed with cancer, I would say the first thing you have to be concerned is not cancer itself. It's like, what is the source for cancer? What is the environment for cancer? You're creating in your body and letting that cancer to grow. Cancer cannot just grow out of nowhere, out of blue.
I wonder how many.
That's funny you should say that.
Oh, go ahead.
I was just say funny you should say that. It's when we talk about environment, people always think around us. I'm like, oh my gosh, well I've got this aluminum plant down here or coal plant or whatever there is. But you talk about environment. We're talking about environment, what you put into your body.
Yes,
is huge, and we kind of bypass that. I was like, well, I go down to
in your body, on your body, everywhere, in your body, on your body is the same way. Like, we're putting so much stress.
Out, around.
This is so interesting hearing it from two people who are trained in functional nutrition, like how you're breaking this all down, because it is like literally the opposite of everything that we're told. So this is information coming from people who are trained in functional nutrition. So it's not like we're just coming up with all this stuff. So like it's interesting because you've looked at so many different aspects of all of this. So what you're providing us is like one, your experience, but it's also your expertise too. So it's just really interesting hearing it from your perspective.
Yeah.
Everything is related. Everything is related. Everything makes a huge impact to the body in everything that we do.
Yes. And we just want to talk about like in the basic language for people just to understand and to hear this, because a lot of science out there, a lot of people talk like medical terminology, and it's hard for people to understand and to hear that. But the bottom line of the diabetes is basically like eliminating the source. And the source is carbohydrate. So you cannot just consume carbohydrate and just hope the diabetes is going to go away or you're going to balance your diabetes. No, you're not, because it doesn't happen that way.
Which I have to add, if your doctor gives you a prescription for diabetic medication, it doesn't mean that you can go eat that whole big lemon meringue pile by yourself and expect everything to be working great. It doesn't work that way. It doesn't work that way. But
that is a bandage. That is a bandage. And a bandage still looking under. Bandage is still looking under. I mean, like the wound is still looking under the bandage. Those meds are like, they basically all bandages. They're not eliminating the root of the problem.
Well, then does the disease end up getting worse over time because
Yes.
you haven't changed the way that you're living or what you're eating or drinking?
Yeah,
Of course.
it
And the
goes
medication that they
constantly.
put you on, what kind of effect is that having on your body as well?
Mhm.
You
Yeah,
know, if you're on, I've been on diabetic medication for, 5 years now, 10 years now.
yeah,
Heaven forbid, what happens when you come off that?
yeah.
What
Even
actually
in
will happen?
Yeah, even in my family, like my sister takes meds. She is taking medication for diabetes. I don't take medications for diabetes. She's a couple of years younger than me, but she looks older than me because she is like still going with the system. You know, the way system tells her she's taking like statin drugs, she's taking like diabetic medication,
Mhm.
meds for diabetes. But it's like she the person, she's someone that does not want to understand, does not want to learn and understand, like, entire, the way our body works, the way we have everything, like in such a intelligence, level. My goodness, it's like our body makes something out of nothing
Hmm.
just because we need it. We need it. You're not going to find a system like that ever, you
Right.
know,
I,
that, yeah.
yes. I need
So,
to add though too that your doctor is putting you on a medication because you're not. I don't want to say you're not. I just want to. It is, and Marinette, you had brought something up as well. It's a mental thing. You have to consciously want to make the choice
right, to
to
make the
make
choice.
those changes in your life to help yourself.
Yeah.
In other words, kind of don't rely on just this one person to give you, a prescription to make it the change. It is something that you can control yourself. It is diet, lifestyle, and nutrition. I know we keep saying that, and we keep bringing that up, but it is so true. But it is really incumbent upon you, the individual, to make those changes. We can give
Yeah.
you the information, but you have really got to want to make that change. And this is your health we're talking about. This is
Right.
your health. That should be
Yes.
the utmost priority in everything. You
Right.
want to be around.
Yeah.
So
And one more thing that I want to add to
running
that
out.
picture:
Mhm.
diet, lifestyle, and then connecting to the nature. The level of the blood glucose also depends on your circadian rhythm. This is another thing that we never been told about. It's exposing yourself to the morning, sunrise. It is so important in balancing like a blood glucose levels for people who are diabetic there, because our entire body is a part of this universe. We react to the circadian rhythm of the nature. Our, we react to the light, the way we see the light, the way the signal goes to the brain from waking up in the morning and being out there, and standing while you see you don't have to like stare at the sunrise. You just have to be present, and at that sunrise, that is gonna balance your cortisol levels. If it balances your cortisol levels, your insulin levels goes down. So there's so many things that we have to pay attention to. It's not only about food. Yeah, food is, as I said, fundamental foundation, but it's many other things too. Your mindset, the way you expose yourself. You cannot isolate your body from nature because it is part of nature. All this like synthesis that goes through your skin, through your, retina of your eyes, like reflecting from universe back into your body,
Mhm.
balancing everything, many things like works in our body just because we have to expose ourselves to nature.
Mhm.
So
Yeah, it brings us back to I kind of like to think of it as a neutral.
yes.
Kind of brings us back to that neutral. Whether you're feeling super stressed out or even like if you're like extremely elated, I just kind of felt like nature when you're out in nature, even just grounding, putting your feet in the ground, it brings you back to that center so you can feel like you can breathe again. And it's almost like your
Yeah.
body knows it needs it. It's like it
Yes,
knows it needs it. So it knows it needs to go outside. It needs to see the sun.
it
Um,
does. It does, because we are part of that process. We are part of this whole entire thing. You cannot isolate humans from nature.
Mm-mm.
Yeah.
No,
We
and then I
can,
kind of wonder how much, and this is could be a whole nother topic, is how much, because we're not doing that, we're not connected to nature, does that actually increase our stress? And then our stress increases, and a good majority of people do emotional eating, have an emotional eating
oh
issue,
yeah.
which then
I
contributes to diabetes. So it's all connected, like you were saying, but like because we're so disconnected from nature, is that causing a whole nother problem, you
yeah.
know?
The
Because
vicious
many,
cycle.
yeah, many functions of our body depends on nature, depends on that sunlight, depends on that darkness and morning sunrise. It depends on many things. So when we isolate ourselves, we don't understand what we're doing to ourselves. So as I said, we're in nature is a whole one. You cannot cut piece of it and say, oh, you don't need that.
Mhm.
You know, it's not going to work out. Yeah. So this is like about diabetes for people to be more mindful. Instead of balancing, you have a great chance to reversing your diabetes and get off those meds that doesn't do well in our system anyhow. At some point, they're going to create something, some other health conditions. It is like it's basically being mindful. Some people would say, "Oh, I cannot do that." So it's the choices you make. It's all come down to the choices you make for yourself.
Well, and I think we get so passionate talking about it because we've had uh life, flash before us because of these things that are rooted in diseases that we were ill, had an issue with and we overcame. But we just want to be able to prevent how many of you that we can, many of you to be able to not go through that like we have gone through, to not
Yeah.
experience that. And so if we can, share our knowledge and our experience with you, that's what we're wanting to do.
Yeah, that is so true.
Mm-hmm.
Yeah.
Yeah, it's just something simple and it's a total mind game, but you know what? Like we were talking earlier, once you get past that, oh my gosh, that cookie would sound great, or I'm a chocoholic. If I wanted a candy bar, that would be so great. But then think about how you feel afterwards, because we've each taken that step where we've changed our diets, we changed our lifestyles. So if you think about consuming that, it doesn't feel very great when your brain is remembering what your body is going to feel like. And then once we do, it doesn't feel very good. It just is that's that another reminder of why we stay away from that. So your mind does change, like, oh, I really want to have that piece of pizza or whatever, to like, I really don't want to deal with what's going to come afterwards, So
Yeah.
your
The
mind just
aftermath.
changes, and it's
Mhm.
like it doesn't even seem that it's important to you anymore.
Yeah, yeah, a lot of people tell me like I have a strong like willpower. Like
Hmm.
I don't eat that. It's not about like eating anything. Like I mean eating stuff. Like yes, I go places, for example, if I would look around the table, if I don't see anything that is, that I could eat, at this point it's not my like me wanting. It's like my logical thinking pops out in my brain. Like, do I really need it? It's not like I cannot have it. I can have it. I know one meal is not going to do a lot on the body or do big changes, but my logical thinking is like, pops out like, do I really need it? This? Do I really want it to put something that is not going to benefit me? Just because it's food. It's just the food, for God's sake. We're obsessed with food,
We are obsessed with food.
we
We are
are
ultra
obsessed
obsessed with
with
food.
food. Yes, this is culture. Like with the culture we live in, we obsess with food. Food should not be an obsession. Food is source of nutrients that you put in your body to function throughout the day and make your body work in so many ways. So it's a source of nutrients, and what kind of nutrients you put in and what that source is coming from is so important. So if I see on the table that there's nothing I can put in my body, then it goes through my brain. Okay, it's going to be a fasting day today.
Mhm.
That's all.
It is. I have to laugh
That's
because it
all.
is. And I did that this weekend too.
Right?
I was like, well, I guess I just won't be, I'll just extend this not eating thing for a while.
Exactly.
And it's
Exactly.
And you know
interesting.
what? I survived.
Yes, and you
Yes.
don't feel like you need it. You don't feel like your body, because
You
like
don't.
you're talking about those small ways of eating, the small meals, drag it throughout the
Right.
day, or
Yeah.
eat
Yeah.
more plant-based or whatever. Like you're starving and you want to just be able to like give your body the nutrition and stuff when you're eating that way. But when we go the
Right.
opposite direction, we remove those things. It's like Deb was saying,
Yeah.
you can go that whole time. Oh, and
Yeah.
like Maya's saying, you can go with choosing to fast instead because your body is not like I almost think is like my body is just like suffering and just is like trying to shut down when I don't eat the way that I do now. I
Right.
don't know if you guys experienced that too, but
Oh yeah.
Oh
It's
yeah.
yeah, it's
Oh yeah.
terrible.
yeah.
Yeah.
When you're on a low carb diet or no carb diet, then you don't experience those hunger moments. Like you're fasting
Hmm.
fasting
Hmm.
for me, it's so easy nowadays. Like if I don't eat, then I don't eat. I don't like, oh my gosh, I'm starving. I gotta eat something. I
Yeah.
don't go through those stages anymore. I'm like, I feel a little hunger, but it's nothing like, I mean, we can sit down, talk, and bring like a lot of science into the picture, like, share documents and blah, 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 and stuff like that. But
I
we
know my son
decided
says that
not
to
to
me.
do
I'm
that.
starving. I go, yeah, I'm pretty sure you're not. Pretty sure you're not.
Yeah, to because people don't understand for the body to starve, you have to probably not to eat for 20 days and then you can say, okay, I'm starving. That's it. Your body doesn't
Oh
go
my
through
goodness.
starvation process because there's so many sources inside of our body sitting there and just waiting until like we go to the when you go through starvation, when you have nothing left in your body, then you're starving, inside to burn
Yeah.
those fats, to burn those like glucose or, break down even muscles, that's when you starve. But starving for a day or two, it's not starvation, you know.
That brings up a really good point, maybe, because our bodies are actually we're intended to fast. I mean, that is just a proven thing. The amount of healing that goes in your body, on in your body when you're fasting is significant. So, I mean, our
Yes.
bodies were not meant to eat 3 meals a day, all day long, every day. We were meant to fast.
Yeah.
So if we're eating in a way or consuming things in a way that we're feeling those hunger pains or we feel like we are starving, then
Hmm.
maybe what we're doing isn't correct because our body
Yes.
is not functioning at the optimal level that it's meant to.
Right.
Right.
Which
Right.
I think
Right.
is why we go back to like
That's
what we
exactly
talk about
right.
going back to your
Yeah.
ancestral eating, but like that should be a good indicator to us. Like something's
Yeah.
not working, we need to change something. The
Yeah.
supplements you're
Right.
taking is not working, you need to change something.
Right.
Hmm.
Yeah,
Hmm.
people that keep doing the same thing over and over and then hoping to get the results,
Mhm,
and they keep doing it. I don't
Right.
know, like, I mean, like for me, I was constantly changing, like to
mhm,
see, okay, what is it going to show me the result? So basically, when you bring higher fat and then moderate protein into the picture, you're going to be less
Hmm.
hungry, you know. Um, you're not gonna be obsessed with that food in the morning when you eat a meal like that. You're gonna realize that is your hunger levels goes down by a lot. You know, you're
Hmm.
instead of like because you're giving a food that your body is using as a source of energy, as a source of building block and everything else, right? Your body has everything to work with at the moment. And it takes it about 5, 6 hours, sometimes even 7 hours. For me, sometimes if I eat a nice meal, I might not want to eat anything until morning.
mhm.
You know what I'm saying? Like until the next day. I don't feel hungry, then I will eat it. So that's mean my
Hmm.
body has what it needs right now to work with. The sign of hunger comes from sign of nutrition deficiencies. The
Mhm.
body is nutritional deficient, it would make you feel hungry because it needs that and it wants you to give that what it's depleting on, but you keep giving something that the body doesn't need, which is a carbohydrate,
Mhm.
and that's why people who consume carbohydrate, they get hungry every 2 hours, every 2 to 3 hours. They want to eat every two to
Hmm.
three hours. Even like every hour or 2 hours, they want because their body did not get what it needs to work on, you know. And but when you eat when you put what you need, then you feel much better.
Mhm.
And then
Hmm.
it's just
Hmm.
like a dehydration is another one,
Mhm.
dehydration, if like you are gonna get hunger symptoms if you're dehydrated. So drinking water with minerals, helping your body. That happens to me a lot actually when I feel like, oh, I want something, I'm craving something. And then I was like, oh, let me just drink my water. As soon as I drink my water with minerals, I'm not hungry anymore. I'm not craving anything
Hmm.
anymore. That's
Yep.
it. Done. You know. we didn't want to break down the food choices here, like stuff like that in this, like eat this or do this or do that. We just want to touch overall like a, picture on diabetes. Um,
Could we maybe do that
yeah.
next week then? I think that'd be a
Yeah,
good idea.
That'd be a good one.
Yeah, we can talk about seasonal food. We can talk about other food next week, and talk about meals.
I think it'd be good to hear just your guys' opinion and your experience and your expertise too, like showing us why the way that we are doing things right now is not working. It's not
Yeah.
helping. It's not making a difference.
Yeah.
And maybe being able to explain, how that works and why, because we have been told the complete opposite. I mean, that's what I'm coming to
Right.
find. The more that I'm reading, the more that I'm learning, the more that I'm diving into doing my own research, the
Mhm.
more I'm finding that is just, we've been told the opposite.
Yes.
Just been the opposite.
Yeah. Yeah. For me, it worked when I started doing everything opposite.
Mm.
I'm just talking about myself, my personal
Mhm.
experience. Everything that what I've done, it was completely opposite what I've been told,
Mhm.
what I've been taught, and what I was reading, and what I was hearing. So I started doing a lot of opposite things and start getting the results.
Mhm.
So, and what result, who gets it, that's up to you, right? What kind of research you do, what do you think is like fits you best, and that's probably like how we have to look into the picture, right?
Mhm.
Yeah.
Maybe teaching people how to, we could probably even work on that later on, but teaching people how to be able to do that research for themselves to be able to make that decision, what the decisions are going to be best. We've unfortunately had the chance of learning on our own for many years. So maybe if we explain how we're able to do that, we can help other people out.
Right. Many of us come to this
Perfect.
picture because
Good
of
idea.
our own lifestyle, right?
Mm-hmm.
Because what we experience ourselves, and we just want to bring the awareness. Okay.
All right, I'm going to stop the recording for now. We will see
Yes.
you guys next
Thanks,
week.
everybody.
Yes.